And we are here at Face of Beverly Hills in Beverly Hills, so stay tuned. Hi everyone, and we are here in Beverly Hills at Face of Beverly Hills with the famous Dr. Mccoy Moretz. How are you, doctor?
I'm just great. So lovely seeing you again.
Thank you so much. We are so honored. And as we know, Dr. Moretz is a facial plastic surgeon and cosmetic surgeon, correct?
Exactly. You did that very well. Good for you.
Thank you so much, doctor. Thank you for inviting us. Your place is very lovely in the heart of Beverly Hills. And the Face of Beverly Hills, Face of Beverly Hills is different than other faces, do you think?
Well, what people tend to believe, whether it's true or not, is that Beverly Hills is sort of an area of elevated beauty and culture, and that's for debate. But otherwise, what I want to have people understand is I want to bring a consciousness of culture and beauty and self-worth to Beverly Hills and to the world, for that matter.
Amazing. And anyone from any place can come to Beverly Hills at Dr. Moretz here and have the Face of Beverly Hills. I think so, right?
Absolutely. I have people from Asia coming. I've got a lady next month coming from Cairo, and all sorts of the East Coast. I'll have a practice on the East Coast, but say people up in Canada or in New York will come here, Florida, but then others from England and other countries will come here as well.
Yes, definitely. Okay, so what makes so unique of your place so people from every place in the world come to see you?
Because I'm so special, I guess. No, just joking.
You are.
Just joking. It's one of those things that, advertising is the face that walks down the street for me. So people tell people when they're happy. People tell everyone when they're unhappy, but people tell people when they're happy who did their work when they are asked, or they just ask how they look so good. And they have one client who never says that she has surgery or things, but she says, Dr. Moretz knows all my beauty secrets. See what beauty secrets he can share with you. So I always thought that was very cute.
That's amazing. So when we hear plastic surgeon, we think that I can do my nose, I can do my chest, I can do my other part of my body, but I know facial plastic surgeon and cosmetic surgeon, they have much more to offer and much more stuff we never even heard of it. So can you please teach us today about your secrets?
Be happy to. Be happy to. Yeah, it all starts from the inside out. You got skin on the outside, but it all starts from the inside. So I do actually speak a lot with my clients about health, about dieting, about nutrition, about certain supplementations, things of this nature, just to help the body work at its best. And then other things that we do, really, I try to start minimal, whether it be certain types of skin care and skin treatments, and then progress into the different things such as the injectables, such as Botox, as well as Juvederm, as well as different things that we can do to the skin gently and minimally invasive, such as the microneedling, also the microneedling with radio frequency, so we add power also to the little needles that go to the skin to increase collagen. Different injectables, such as from your own blood, the platelet-rich plasma, PRP, as it's called, as well as other biologic stimulants that are also from people, but just not yourself, whether it be amniotic membrane or stem cell type injections, things of this nature, all can be used to help stimulate your biology of your face, your hair, all sorts of areas. And then there's the surgery, which is with the scalpel or the cutting. There's also minimally invasive surgeries that also use radio frequency to help cause lifting, to remove fat that we can put into the face and help volumize it, or the breasts or the buttocks, the Brazilian butt lift as people call it.
All kinds of magic.
All kinds of magics, wow. Yes.
So doctor, before I go further, how many years you've been doing that?
More than you've been alive, probably.
So 32 years of experience. You started from North Carolina?
Well, I was born in North Carolina.
Oh, great.
After college, I migrated into Georgia for medical training, as well as what's called postgraduate training after medical school. And then I practiced in the Atlanta area for almost 20 years before moving out here 14 years ago.
Oh, amazing. So 14 years ago in Beverly Hills.
Correct.
Okay.
Yes.
Great. So you gained many experience with people, definitely. Is here is different than any other place you practice it?
It's interesting in that there is a culture everywhere. There's a beauty culture, very, very intense here. Some form of beauty industry or self-promotional industry, and I include singers, actors, all in self-promotion, because what are they selling when they're singing or they're acting? Themselves. And so all of that in a culture of any sort has an aspect of one's appearance. Now, you have people whose appearance is meant to be stunningly beautiful, but you also have the character actor who's kind of quirky or even, dwarfism, bad look, whatever you want to say that might play in a thing. They've got to have the weathered skin and all. So that's not a beauty culture as such, but skin health and skin beauty are the sort of the areas that I dwell in.
So in my life, I see like two opposite people. One person who don't care about their faces at all, like, I am natural forever. The other person, they put many surgery and stuff in their faces. So how I can be moderate, and how you can teach us to be moderate?
As we were speaking about earlier, I think that so truly one of the things that as a physician, as a doctor, I am as a teacher. And that is so much, people will walk in the door and they say, tell me what I need. And it's like I'm supposed to read their mind. And so the first thing I always tell them is, you don't need anything I'm doing. Number one, I'm not doing your heart operation. I'm not removing a cancer. I'm not giving you a kidney transplant. We're doing something that's elective. It's wonderful, and it has great self-value and self-worth to make you feel good, because you feel good when you know you look good. You put on a nice suit or you put on a beautiful dress and you feel confident, you feel good when you go to a business meeting or you go to a party. You know the same thing if you feel that your face looks its best, or your breasts look the best, or your body is shaped properly, so that, like one lady told me, she says, when I go out now, I have one less thing I have to worry about, and that's my appearance, because I know I look good. And that makes you feel good. That makes me feel good too.
So if we started from the scratch, I want to take care of my skin, because the face is like everything, mostly. So how I can take care of my face on a daily basis, and the minimum procedure, I can come to Dr. Moretz and tell you, please help me to be beautiful every day.
Okay.
Was one procedure, then I have to take care with myself.
Okay. Well, some of the simplest things are avoid sun exposure, SPF. Drink a lot of water and hydrate. Drink a limited amount of alcohol, because that does dehydrate you, and never smoke. Never smoke anything. No matter what's legal or illegal, it all is carbon monoxide, and it just depletes the energy in your life, cells of your face, your collagen, and it's damaging. Other than that, the things that I think are really beneficial would be, and that already included the sunblock, the one thing would be the microneedling that I can do to an individual very, very gently on a once every few weeks or every month basis. It's got a super short recovery, and the little small micro injuries to the skin, almost like tiny little thorns from a rose bush, stimulate your collagen to grow. They release a small amount of blood, which the blood has platelets, and the platelets have your plasma energy growth factors in there to help stimulate. That's how it heals. The blood platelets release peptides that stimulate your skin to heal from the puncture wound of a thorn. Or with me, it's more what I'm doing to the skin. So that's a very gentle treatment that's very easy to do. You could do it, something like that monthly would be good. Otherwise, your skin care, your moisturizer, something, a gentle cleanser for the skin, and a moisturizer and a SPF. Sun factors, yes, prevent that.
One of the pain for most of the ladies, the neck. When they are older, they are more wrinkled and they are very shy. So what you do to make them like youth?
Yeah, the neck is a real problem child, as I call it, because the neck is an area that suspends off of the jawline and connects down here. Your face is a little different, or a lot different, in that you have the eye socket, you have in the skeleton, the nose, you have the mouth, that many different ligaments attached to the support area of your face. The neck is so much more complicated and delicate, and the skin is different there. It's much more thin and delicate. And so probably some of the moisturizing is a key element to daily things to do. And one of the best things that I have now to treat this is the radio frequency microneedling.
What is it?
That is also small micro needles. They're smaller than Botox needles that we use in the skin. And each time I use the device, there's 49 going into the skin at one time. As they're in the skin, they then release heat energy at different levels, because the skin, you have the epidermis on top, you have the dermis in the middle, and then you have the fatty tissue below. So where the radio frequency needles go in is at different levels through the dermis, and it stimulates the collagen so that the skin becomes more tight. And especially the neck, these are very difficult lines. So the simplest thing I can do to help improve them is the radio frequency microneedling to help stimulate collagen and smooth those lines through there.
These are safe procedures?
They're safe for all skin types.
Okay, so let's go back to the part of the cosmetology. Some skin has like allergic to some stuff. So what you do for, how do you know the allergic skin?
Okay. That is a very hard part. Yeah, I guess from an allergy standpoint, you have to listen to the individual and see what problems they've had with allergies in the past. Now, if there's a question of some certain chemical allergies or certain types of sensitive skin, then you always can do what's called a test patch. And that's where you say take something like whether it be a skin care product or a chemical peel product, and you put it, say, typically a little area behind the ear to test it there and see if there's a reaction, or on the skin of the forearm, because that's very thin skin and very delicate skin, and if it reacts there, then they're probably going to not react properly to it on the face, and then you try something else. And you see what their skin tolerates before you use it on the whole face.
Okay, great.
By far.
So let's move for the bigger surgeries. So how long, if I want to do like maybe my nose, or I'm not happy with anything of my body, how long the recovery after that, and how like many years before I come back and repeat the procedure?
Okay. Typically, we'll start off with one that really should not need to be ever redone again, and that would be a nose. Do a rhinoplasty and restructure someone's nose, it should then be permanent and not need to be redone. Say like eyelid surgery or facelift surgery might need to be redone over time. The nose recovery is an interesting sort of location. Recovery is probably most complete within about 3 months. Even within 2 to 3 weeks, it will typically look better than it did before the surgery, but a good result is pretty close to being finished at about 3 to 4 months. But there's subtle changes that will happen with the nose for even 2 to 3 years after an operation. Subtle things, things that you would notice in the mirror but not anyone else. So that's an interesting animal there, the nose is. Say certain other things like the eyelids or the facelift, those typical operations will last anywhere from say 5-7 years for an eyelid, because the brows tend to drop and the skin tends to get older. Or with a facelift, depending on what type of facelift is done, results can be good for 8 to 10 years before one wants to consider another facelift. Mm-hmm.
What about the eye puffiness?
Yeah, that typically, if you're doing that surgery, the puffiness can be reduced once with the surgery and it won't come back. But the skin will get relaxed, and that's where the microneedling radio frequency can help benefit. Sometimes another little removal of just the skin only, what we call a pinch blepharoplasty, can be done because there's no puffiness there, but the skin ages with time, and so things that we can do to help slow that aging or to reverse that aging, such as the cell injections with the stem cells or with the blood plasma, all helps to keep the skin young, or even makes the skin younger. It's regenerative.
Okay, so let's Talk about this first type of people when they don't really care at all. Maybe a lady, she's in 4 years old. She didn't like notice any like changes in her face, but within 5 years she might notice a lot of changes because she was a little bit ignorant or careless with her face. So what exactly we need to do in our 4 years old?
Okay.
Before anything happens.
Before anything happens, right? Exactly. Well, as we mentioned, hydration, minimal alcohol, no tobacco, sunscreen. Other than that, I think some of the key elements would be certain types of enzyme masks or chemical peels that can be done to help exfoliate the skin. It helps with the sun blemishes that cause dark spots. Where like oftentimes ladies after having pregnancy, they have that mask of pregnancy that comes up, those melasma type pigmentation spots. Those can be improved with certain types of peels to help take away the dark area and smooth the complexion. Also to help remove, because the skin, the upper layer of the epidermis is dead. The top part is dead, the living part's
When is dead? In what age?
always. The skin is living and growing from the bottom up. So what we're seeing on top is actually dead skin. So that's where, like, using a gentle exfoliant or estheticians doing microdermabrasion is like polishing away the old dead skin. And so some people never do anything like that. They never use any masks. They never use any exfoliants.
How dangerous is that?
Oh, it's very safe. It's very safe for all skin types to do.
How dangerous if you don't use anything?
Well, I won't say it's dangerous, but it just doesn't look good. Yeah, and that could be dangerous in certain cultures, right? No. In Beverly Hills, it's very dangerous not to look good. Just joke. No. But, yeah, so things that help make your fresh skin, which is your youngest skin, which is your deeper layers, show and glow. That's where your glowing comes from. If people have dull skin, they have fine cracks in the skin, mostly that's because they don't ever do anything to exfoliate or to remove the dead cell layers on top.
So you need to exfoliate.
You need to exfoliate, yeah. And there are things safely can be done at home, and there are things that are best done by estheticians who have the training to safely do the deeper exfoliations without, one, damaging your skin, causing bleeding or causing scarring. People can buy all sorts of things on the internet that they probably should never have in their home these days and do some damage to themselves with over-aggressive treatments that they're not trained to do.
Exactly. So yeah, people, sometimes they say we're gonna save some money and we're gonna do that, and they end up with catastrophe, and your face is nothing like, it's not like something to play with.
True. People will buy, I mean, I've had colleagues tell me that they've had people walk in the door with fillers or Botox that they bought online and say, can you inject this? I got it for a discount online. Well, number one, probably 80, if not 90+% of all those products online are counterfeit. They're not the Juvederm, they're not the Botox, they're false, and they're just ripping people off and potentially causing great harm and great damage. So you got to be very careful what you buy from a place that says they have medical products for sale to someone who can't prove a license, because most of that's probably fraudulent and then dangerous too.
So it's very important to invest in yourself in a safe way, because your face is not like a trial or anything like that. So tell me, doctor, we hear that plastic or cosmetic surgeon could be very costly or like expensive. So can you tell me when we come here and how we pay you, credit card payments, what you do for payment?
Okay. Well, we have many different means for payment. Cougarans, no, just joking. We'd take...
You take gold and diamond?
By the troy ounce, no. But, basically any form of modern currency is available, whether it be, cash or credit card, check, things of this nature. We also have financing options. There's a company called Care Credit. There's another one, I believe it's called Greenway. We have a couple different companies that provide credit that's outside of your normal MasterCard and Visa, American Express type of credit cards.
The interest is maybe less?
The interest can be less. It can also be a way of extending payment for years or months Some of it's sometimes interest-free, some of it is at low interest rates, but it provides some way people can finance a cosmetic procedure, a plastic surgery procedure, without having to go to their MasterCard. And those get very expensive, so those are high monthly fees that most of these companies, it's similar to, say, someone financing a piece of furniture or equipment or something else through a third-party financer.
Yeah, okay, so it's easy to, it's very safe to be in some hands very experienced like Dr. Moretz. So Dr. Moretz, tell me about an experience you went through. Someone or a lady, she wasn't really convinced to do a surgery on her face or cosmetic like facial something, and after that she encouraged her friends to come to you.
Okay. No, that's, well, like we were talking earlier, my main advertising is word of mouth. Yeah. By far. That's predominantly the way all of my patients come, is they are referred by someone who's a happy customer.
That means you are an excellent doctor.
Well, thank you. I appreciate your saying that. But yeah, no, there's that's quite frequent. Let me think of an example here. Yeah.
Pop-up question.
I know, right? Yeah, you put me on the spot here. But it is one of those things that happens. Like I did have this one lady who, it was very sweet. She wrote me a very lovely letter too. But she was like, she never considered herself to be a raging beauty. And honestly, she wasn't. But she was concerned about her appearance, and she always wanted to do something, and she did. She used financing, as a matter of fact, as well. And she had some procedures done on her face, and she wrote me a lovely letter, and she talked about how now when she goes into a public situation or a place, she stands taller. And I just thought that was she stands taller when she walks into a room. But she had her daughter come in to see me, and her daughter had seen the change in her mother's outlook and her presence in public, and yeah, things of this nature. Just what enhances, if you feel good about yourself. That's one thing. I've had several executives, both male or female, but especially some ladies, because our culture is very much harsher on women aging than it is on men. And so I did have one lady who said she was a corporate executive, and how she noticed that after she had some things done, and it was a very interesting perspective on culture for her, but after she had things done, some of her younger executives listened to her more and listened to her ideas more, because they didn't see her as much as the matron in the room, but more as a contemporary in the room, which I thought was both sad and good at the same time, because it allowed her to get her wonderful business ideas heard, but for her to see that was also a cultural perspective that is a statement there.
The confidence from inside, right. So that's very important. You need to look good so you can feel good about yourself and be effective in your community.
Exactly. I had one gentleman who was, because of when the economy crashed, back around 2008, he couldn't retire. And so he was having to go back into more active work, and his boss was like 45, and here he was like 62. And he was like, I got to wear a tie, and I don't want my double chin to hang over my tie. So we did a neck lift on him and made him more socially comfortable with his younger executives.
That's amazing examples, and exactly, you are a magician and you are a miracle too, so you do miracles in people's life. We're so honored to have you, and I wish of everyone, because our culture, we get like shy if someone said like, did you do your nose, or so we need to be like open for the ideas, and bring the confidence out of yourself, and never be shy from anything, and be the one you want to be. So doctor, that's amazing. You like touched my heart, and your stories are amazing. Your customers are amazing too. So I need you to take the mic and give advices about, and tell us more about your place and why we should come here.
Okay. We have a very nice but boutique office here. So we take very intimate care of all of our patients in a nice compact location. So here is one of our esthetician's rooms. And it's quite bright, quite lovely.
Wow.
All the toys in here for skin care, the LED lights, the microcurrent, the dermafrac, all sorts of things to help enhance the beauty of the skin and just keep the cell renewal going, help to stimulate the collagen from a facialist standpoint. Serums and extracts galore over there.
Okay, so esthetician, so you don't proceed with your tools in the face, but you put like skin stuff, right?
Exactly. This is where the men and women become red carpet ready before a event. They come in here and they get their face cleansed. They get some of various types of extracts placed on the skin to make it glow and look luminous before the bright lights. And hydrate, hydrate, hydrate. We're in California. Things are very dry here. So this is where that sort of magic happens.
Okay, great. So this is the brands you...
These are some various products that we have that are used in what are called the back bar. They're used on the clients, but then they're also able to purchase these and take them home from the standpoint of various skin cleansers, things to be moisturizers, things that are enzymatic masks to help exfoliate and help remove dead cell layers. So all the little different things that everyone needs, both men and women, to make the skin look glowing.
And what age they can start these, in your opinion and with your experience?
We even have young adolescents from an acne standpoint come in because acne is such a problem. Obviously, it's a very significant cause of either self-esteem issues or even bullying, which is quite horrible. But as an adult or as a child, so we do have adolescents even come in to have extractions done and skin treatments to help with the acne. But honestly, with this environment and almost any environment, whether it be pollution or dryness, at 16, 15, you should be taking care of your skin and using good quality products for the rest of your life.
And do you think these effects that we can be like, have a younger face, right?
Exactly. If you keep and maintain, if you're 15 or 16, you got a young face. Yeah. If you keep that face young, then I have less work to do because it doesn't get as old as quickly. It's going to still get older over time, but my work is easier if you have good quality, luscious, hydrated skin versus dry, withered, leathery skin. It just makes it a completely different environment for me to operate or work with by helping to maintain it from a youthful standpoint all the way into young ladyhood such as yourself, into old ladyhood as our parents, things like that.
Okay, great. Thank you. So what about the next room? Let's see.
We'll wander over that way.
Okay.
So this is my main sort of consultation room as well as injectable room. So this is where I do, whether it be the Botox, the Juvederm, the Voluma, the different things to help plump and hydrate or paralyze the muscles that are causing wrinkles in through here. So I also do the microneedling in here and the blood platelet, the platelet-rich plasma injections into the face to help hydrate the skin and stimulate the collagen to grow.
Okay, can you explain these first, and we'll go back to what you're doing. So can you explain?
Yeah, these are exactly, various certificates. One is my medical board here in, well, not here, but this is actually in North Carolina where I also practice on the East Coast. And then various board certificates of my medical board that I'm licensed through or boarded through, and facial plastic certification, fellow in that society. Another one up here for advanced training in high definition body sculpting. So it's using the Vaser technique, which is a whole scientific way of removing or loosening fat to where you can then sculpt the body and create shape and form. Similar to an artist using modeling clay to shape and form the body, I use the fat and certain techniques I've learned to help shape and form the waistline, the breast, the buttocks, the thighs, whatever, the neck, all these areas like this. And then this one in the bottom here is my original medical degree from medical college. Yes, the big one. My medical university wanted to make sure the biggest diploma on your wall was the medical degree, which I think is quite funny, and it's all in Latin.
Design. Okay, that's amazing. So tell me a little bit about them. I know that when you Botox and stuff like that, I hear this can be addicted. Is that true?
Well, looking pretty is being addictive. I mean, wearing lovely clothing is addictive, right? Yeah. No, there's nothing that, say, a physical addiction or dependency, and I hope no one would psychologically become addicted to, because then that becomes a whole kind of issue with body dysmorphism and body self-esteem if someone becomes addicted to something like that. But it does a wonderful job to help relax the facial muscles so that crow's feet and forehead lines or smile lines can all be much more relaxed and not as evoked when you're living life.
Yes. Okay, so when someone comes, young age or old age, you give them guidelines, so you cannot do it every, like maybe in 6 months you come back, or 1 year, you cannot do it every week, because I know girls, they like to go every week to just add to the Botox or the lips or something.
That's sad. Yeah. No, the Botox typically will last about 3 months. Sometimes it lasts shorter, sometimes it lasts longer. It just depends on your metabolism and how your body processes the neurotoxin in the nerves onto the muscles. Things that are fillers, various ones have various lengths before the body absorbs them, such as the Fabella here is one. Both of these will last about 12 to 15 months before the body absorbs them. Whereas, let me get the other one out that everyone hopefully has probably heard of, which is also by Allergan, Juvederm. Juvederm lasts about 8 months, but it's various ones are different densities, they're various amounts of firmness, so they need to be used in different places. Some are, say, good for the cheeks, some are good for the lip lines or the crow's feet lines, some are good for filling depressions in and around the mouth. So the different products are very specifically designed so that the surgeon or dermatologist or other injector who's got expertise can use the right product for the right location.
That needs a certain experience. We cannot just go walking somewhere and doing anything in our faces.
No, it can be quite dangerous. There are abilities to have these products in inexperienced hands be injected into vessels that might cause skin death or even blindness. So it is a very technical thing to do, in certain areas, especially around the eyes or around the nose, need definitely a master injector or an advanced injector to have the option of best safety.
Okay, great.
Right.
So you are the expert, and thank you so much. I love this. This one, we're going to talk more about that, but we can go to the next room.
Okay.
Great. So this is where the magic happens. Tell me what.
The magic room. Yeah, we have lots of toys in here. This is my toy store. Okay, so have all the lovely things. So first toy, let's talk about here. This is a radio frequency microneedling device. So many people have heard about microneedling, very small little needles going in and out of the skin to help micro-injure the skin and grow collagen. It works great. It's been around for decades, if not centuries, in ways to help improve fine lines and wrinkles. What this does is it adds power. It adds electricity. So with the device, when it comes on,
so you feed the skin collagen. You feed them collagen.
Not quite. I help make the stimulation of collagen. So the device has needles that go on the end, and then I go along the face or the décolleté or the wrinkly arm skin or stretch marks on the breast or abdomen, anywhere there's skin, and it has the ability to put heat, very, very controlled radio frequency heat into the skin under the skin. So all skin types, from as dark black ebony skin or as white Irish type skin, can be treated safely with this device to grow collagen, smooth the fine lines, smooth the wrinkles, actually give a bit of a nice lifting to the face if it's done in a series.
Okay, so if there is a lady came here, or young lady or old lady or whatever lady, she came and she said, I want to do Botox, I want to do that, I want to do that, and you look at her face and she don't need all that. So you give her exactly, you look at the face and exactly that's what you need, or you give her what she needs and that's it. Or what she wants and that's it.
I'm very much a communicator. In other words, I like to run my mouth and talk a lot. No, just joking. But I think that if you look back, and it's always been my heartfelt that the Latin derivative of the word physician means teacher. And if I'm not teaching people who talk to me, whether it be about Botox or about filler or a rhinoplasty, if they don't learn something when they speak to me, then I'm not doing my job. I'm not just a salesman. You need to sell you this, sell you that. That's not where my heart is. So I want it to have an interaction with the person. Some people have unrealistic needs. They want this and that. And I go, you don't need it. You don't need it. You're too young for that. Or that's not what you need to really create the aura of beauty. Because not everyone thinks of beauty in the same way. There's all sorts of people on TV and in movies that give a very strange view of beauty to the world, and some people feed into that versus let their natural beauty come forth. That's what I want to do, is enhance your natural beauty.
Oh, that's amazing, doctor. Great. So they come here and you do the minor surgeries.
I can do the minor surgeries here in this room. This is a big one, but it's a wonderful one. It's for cellulite. And that is a genetic issue, because cellulite isn't just for overweight people. You can have some very thin, you know, not 15, but say 18 to 25-year-old model-size individuals with cellulite, because cellulite is a genetic problem. It actually is caused by little fibers that go from the skin down to your muscle, whether it be on the thigh or the buttocks. Those little lines of collagen are too short, and so it pulls the skin down, creating the cellulite dimple. This is the device I use just here in the office with the individual just laying on their tummy and feeling comfortable, because I numb the area to release those fibers and lift up the skin. And it just came out with a 5-year study showing that 100% of the people who had one treatment still saw improvement 5 years after the treatment.
It was just my next question, how long for me to see the result?
Oh, results are usually seen within 2 weeks. There's a little swelling, as with many minor procedures, and possibly some bruising, but within a couple of weeks, one is seeing a definite improvement in the cellulite. And I'd say optimal results, best results, are between 6 and 8 weeks, but it's very fast.
Very fast.
Minimal discomfort, minimal downtime.
Okay, great. And you told me you're doing some lasers too. Where are you doing some laser? Which part?
In here is different lasers that I have that are able for collagen renewal for the face. Carbon dioxide lasers, my favorite one, but it does a really great job at opening up the skin to be more stimulated for collagen. And then this is an interesting little laser. It's a laser cap for hair growth. It's got, yeah.
So you do hair growth?
So we do hair growth. I do hair growth both with the laser type devices for the hair to grow, as well as injections of things such as stem cells, or also the blood plasma to stimulate the biology of the cells in the hair.
Okay, great. Doctor, that's amazing. We really enjoyed, and it's time for some advices from Dr. Moretz, so stay tuned.
Okay. Well, it's been wonderful being here today with all of you and just having this time to share my experiences. But again, being the face of Beverly Hills, Dr. Moretz, I want to be with all of my patients, all of my clients, like a family member. I want to be someone who they don't just come and see, have something done, and wander away, and don't feel that I genuinely, and I do, genuinely want to be part of their lives, to help maintain those things that we do, because it's not just an experience, it's a lifetime of investment, both of the individuals in investing and giving me their time, giving me their faces, their bodies, but I'm investing my experiences. 32 years of doing this has given me a time to become what I consider more of a master craftsman than an apprentice or a newbie in the industry. So all of my little lines and wrinkles I've earned over the years, and I like to help transfer that knowledge to my clients, to my patients, and let them feel that I do truly care about their self-being, their well-being, and their being the most comfortable within their skin. Because we deal with the cosmetic things, whether it be cosmetic skin care, whether it be certain injectables and treatments of fillers and neurotoxins, of certain biologic therapies that truly are regenerative. We're seeing this so much. I travel and practice in China as well as over on the East Coast, but in the foreign countries I'm able to do many other things that are not quite able to be done here in the United States with advanced cellular therapies. But those are things that I'm seeing coming about here in the United States in small increments, which are very wonderful because it can actually, like the starfish growing an arm back or the little lizard growing its tail back, it's able to regenerate and turn your skin and turn certain aspects of your wellness to a younger time. It literally makes one younger. So these are things that I enjoy imparting and sharing with my patients. Surgeries are things that are very intense, both for myself. They're very focused, they're very concentrated, and they also have real recovery time. So we really want to create with our clients the before, the during, and the aftercare needed so that they can have optimal recovery, fastest results, and then longest maintenance of these things. So some surgeries last a lifetime, as we talked about. The rhinoplasty, if it's done properly, should be pretty much a one-time surgery. Other surgeries, whether it be facelifting or lid surgery, depending on the age one starts, I might see someone 10 to 15 years later and do it again. Did have an interesting question asked to me one time, was what was my oldest patient, and that lady was 87. I did a facelift on her, and she hadn't had one before. And I asked her why at 87 now, not that it was wrong, but why did she decide that she wanted a facelift at 87? She said that, well, all of her friends that were her peers had died, and that she was hanging around these young girls who were 65. And they all looked younger than she, so she, at 87, wanted to look as good as her 65-year-old girlfriends. Yeah, and so we did this. I said, that is a very wonderful reason, because you always have to be, in my business, conscious of why someone is seeking a surgery or seeking a treatment, because not all reasons are consciously proper, and some of those become psychological issues of individuals seeking something that either isn't proper, not that it's not, say, able to be done, it could be done, but not that it's really something that is going to benefit them mentally or physically. And so there are those times that my most important answer to someone when they ask for a procedure can be no, that this is not for you. And it's not that I couldn't do it, but that it's not going to help with the mind or the heart or the spirit of the individual, which is what I'm always after taking care of. So I look forward to opportunities to see lovely friends such as you here today, Mira, and other friends within all the cultures that I deal with. And thank you for allowing me this platform and opportunity.